Most people think a scoliosis brace means bulky plastic and a guaranteed trip to surgery anyway. But what if that's no longer true? I'm Dr. Juan du Plessis from ScoliCare, and today I'll show you how one teen avoided spinal surgery through a personalized treatment plan which included a custom 3D brace and what that means for families facing the same decision. For parents, there are only a few things that feel heavier than hearing your child has scoliosis. And when you're told the curve is getting worse and fast, it can feel like surgery is the only road ahead. You start asking questions. How bad is it? How fast will it progress? Is there anything we can do to stop it? But often, the answers are vague or worse, outdated. Traditional braces can feel like a placeholder, something you try while waiting to see if surgery becomes necessary. But what if that moment didn't have to come? What if there's a way to step in earlier and actually change the outcome? That's exactly what happened in this case. When Nora Lee first came to ScoliCare, she was 14 years old, deeply passionate about hip-hop dance and in pain. She'd been training almost every day, even representing Australia on the world stage. But behind her movement and strength, pain had become a factor. She'd initially seen her family doctor, where an x-ray had been taken. The diagnosis: scoliosis, a double curve, 48 degrees in the thoracic spine, 42 degrees in the lumbar spine. After seeing an orthopedic surgeon, she was advised that surgery was one of the recommended treatment options for a curve of that size. But Nora Lee and her family weren't ready to accept that. They wanted another path. That's when she began treatment at ScoliCare. Her individualized treatment plan combined a custom-designed 3D Scoli brace, which she wore for up to 23 hours a day, and the Scoli Balance program, a series of scoliosis-specific exercises designed to support real structural change. She named her brace Justin after Justin Bieber. She kept dancing, she traveled, trained, and even did her exercises on the beach in Hawaii. Things started to shift. After 3 years of committed treatment, Nora Lee's curves reduced to 36 and 32 degrees, moving her out of the surgical range. Her posture became noticeably more balanced, and just as important, she never had to stop doing what she loved. Today, Nora Lee is still dancing, and she's sharing her story to help others catch scoliosis early, because early action made all the difference for her. So how did a teenager with a 48-degree curve not only avoid surgery, but see real measurable improvement? It starts with understanding that not all braces are created equal. Traditional braces are often designed to hold the spine in place. They generally aim to slow the curve, but in most cases don't actively correct it. And for many patients, especially those with severe scoliosis, that's just not enough. ScoliBrace works differently. It's a 3D custom designed brace, not just made to fit the body, but aims to correct the spine's position across all 3 dimensions, front to back, side to side, and rotationally. And because it's built from a 3D scan of the patient's body, posture photos, and x-rays, the brace fit is precise and personalized. But the brace is only one part of the equation. What made this case so powerful was the combination of bracing with a targeted rehabilitation program. ScoliBalance. These are scoliosis-specific exercises designed to reinforce the corrections made by the brace. Not random stretches or general core work, but guided movements focused on stabilizing the spine in a more aligned position. Every few months, Nora Lee's exercises were updated. Her brace was reviewed, her progress was monitored with imaging and posture assessments with her scoliosis clinician. Over time, the follow-up assessments showed encouraging improvements. Her thoracic curve, once a 48 degrees curve, was reduced to 36. Her lumbar curve dropped from 42 to 32. And just as important, her posture and balance improved dramatically. These outcomes were the result of early action, the right tools, and a team that knew how to apply them. If you or your child is facing a similar situation, don't wait. You can book a consultation with one of our clinicians to explore whether this kind of care is right for you. Just click the link in the description to get started. Now, let's get back, because you might be thinking, what does this mean for you? Whether you're a parent navigating a new scoliosis diagnosis or a health professional wondering how to better support your patients, there are steps you can take right now to change the path forward. First, don't wait. Early intervention matters. The earlier a curve is properly assessed, the more treatment options that may be available. Second, get a 3D assessment. Not all spinal curves behave the same, and not all braces are designed to correct. A full clinical review, posture rotation, flexibility, and growth stage assessment can help determine if advanced bracing is appropriate. Third, find a provider who offers more than just a brace. What made the difference in this case wasn't the brace alone. It was the combination of specific care, custom design, ongoing support through scoliosis-specific exercises. And finally, look for a team that tailors everything to the individual, their body, their goals, their growth. Because scoliosis isn't one size fits all, and its treatment shouldn't be either. This teen's outcome wasn't luck. Her progress came from a tailored care plan supported by clinical knowledge, research, and practical experience. This case highlights that even in cases of significant curves, there are opportunities for non-surgical treatment. With the right timing, suitable treatment options, and a supportive clinical team, positive changes are possible. And if you're facing a similar decision or supporting someone who is, know this: there are modern, non-surgical options that are built around the individual, not just the X-ray. From all of us at ScoliCare, thank you for watching.